most people have never heard of the Nipah virus. It's not trending on social media every day, and it's not constantly in the news like flu or COVID. But here's the truth. Nipah is one of the most dangerous viruses public health experts watch closely. When it appears, it can hit hard, spread fast, and in some outbreaks, it has had an extremely high death rate. In this video, I'm going to explain what Nipah virus is, how it spreads, the symptoms to watch for, and the smart precautions that can protect you and your family. No panic, just awareness. Nipah virus is a rare but serious virus that can infect both animals and humans. It belongs to a group of viruses that can attack the brain and the respiratory system, which is why it can become deadly. And the scary part is there is no magic cure yet. Doctors mainly provide supportive care, treating symptoms and keeping the patient stable while the body fights the infection. You might be wondering, if it's that dangerous, why don't we hear about it all the time? NIPAH outbreaks are usually limited to specific regions and happen occasionally, not constantly like the flu. But when it appears, it can create a real emergency, especially in communities where people live close together or healthcare is limited. Its natural host is fruit bats, especially a species called Pteropus, also known as flying foxes. These bats can carry Nipah without looking sick, and the virus can spread from bats to humans in multiple ways. That's what makes Nipah so concerning. It doesn't just have one path of transmission. It can spread through contaminated food. Fruit bats may bite fruit or lick it, leaving saliva or urine behind. If someone eats that fruit without washing it properly, the virus can enter the body. In some regions, raw date palm sap has been linked to outbreaks because bats contaminate it. If it's not hygienically collected, drinking it can be risky. It can also spread through animals, especially pigs. In some outbreaks, pigs became infected after contact with bats, and then the virus spread to humans, mostly farmers and workers handling the animals. The third and most worrying way is human-to-human transmission. Nipah can spread through close contact with an infected person, especially through body fluids like saliva or respiratory droplets. Caring for a sick person, living in close spaces, or being around someone who is coughing seriously increases the risk. Symptoms usually start a few days to 2 weeks after exposure. At first, it can look like a normal viral illness with fever, headache, muscle pain, weakness, sore throat, nausea, or vomiting. Many people assume it's just a regular fever, but Nipah can escalate fast. Some patients develop respiratory problems like cough or shortness of breath. Then it can attack the brain, causing neurological symptoms like dizziness, confusion, extreme drowsiness, disorientation, seizures, and even coma. In severe cases, this can progress in just 24 to 48 hours. If someone has a high fever and suddenly shows confusion, trouble breathing, or seizures, especially in an area where Nipah has been reported, seek medical attention immediately. Nipah has shown a high fatality rate in multiple outbreaks. Even survivors can sometimes face long-term effects like fatigue, memory issues, difficulty concentrating, or other neurological complications. Doctors can't confirm Nipah just by symptoms because early signs look like flu, dengue, or other viral infections. Diagnosis requires lab tests using blood samples or swabs. That's why early awareness is crucial. The sooner doctors suspect Nipah, the sooner patients can be isolated and the spread reduced. Since there is no guaranteed cure, prevention is the strongest weapon. Always wash fruits thoroughly, especially those that might have been exposed to bats, and avoid fruits that look partially eaten or damaged. Avoid raw drinks or sap that could be contaminated. If animals are sick, avoid handling them and report unusual illness to authorities. If someone is sick with fever or breathing problems, avoid close contact. Don't share utensils or personal items. Encourage masks, wash hands often, and use gloves if you're caring for them. In hospitals, proper protective measures are critical because outbreaks can worsen when patients aren't isolated quickly. The key mindset is simple. Don't panic, but don't ignore it. Fear spreads rumors, but awareness leads to smart decisions. Respect the risk, stay informed, and follow safety measures. Can Nipah become a pandemic? Experts monitor it closely because it spreads through close contact and can affect the respiratory system. The good news is past outbreaks have been contained through isolation, contact tracing, and public awareness. Still, in today's world, travel can spread infections faster than ever, so staying informed matters everywhere, not just in one country. If cases appear in your area, follow trusted sources like health departments and official updates. Avoid rumors, practice hygiene, reduce unnecessary close contact, and seek medical help early if symptoms appear. Early action saves lives. The most important message is be aware, not afraid. Nipah virus is real and serious, but prevention is possible. Clean food habits, good hygiene, avoiding risky exposure, and seeking medical help early can protect you and your loved ones. Share this information because awareness is protection. Stay safe, stay informed, and take care of your health.